Hey, this is Dr. J, Carpal Tunnel Expert, Carpal Tunnel Express. I was just driving around on a Sunday here, running some errands, and I got to thinking about what's the most common question that I get asked from patients about carpal tunnel syndrome. And the question that I get asked the most is, how do I know if I have carpal tunnel? And so there is one major sign, one major symptom of carpal tunnel that when I hear it, I automatically know. Most of the time I don't even have to examine the person to understand that they have carpal tunnel syndrome. Most of the time you don't need an expensive shocky nerve test to prove to me that you have carpal tunnel syndrome if you tell me this one symptom. And if you have carpal tunnel, you're gonna, or have had it in the past, you're gonna instantly recognize this symptom because it's probably one of the most bothersome symptoms for a person who has carpal tunnel. And I'm gonna tell you in a minute, but first I want to introduce myself. I'm a triple board certified orthopedic upper extremity specialist, and I've been doing hand and upper extremity surgery for about 20 years. I performed a fellowship at the University of Pittsburgh in hand and upper extremity surgery, and I'm internationally known for ultrasound and ultrasound guided procedures of the upper extremity. I teach courses, I write research articles, scientific papers to teach other surgeons how to use high resolution ultrasound to see from the skin to the bones in super high resolution in order to allow them to make non-invasive diagnoses and also to perform procedures through tiny keyhole incisions, which will allow patients in most cases to heal faster with less pain and with less recovery time. So with that being said, there are several really important symptoms in carpal tunnel. The first is really numbness and tingling patients get in the 3 digits starting with the thumb, index, and long finger and half the ring. It doesn't always have to happen that way. Sometimes it could be the whole hand. Occasionally it's just the digits in the middle or the digits on this side that they get the numbness and tingling in. But many patients present with pain as well. It's actually common for patients to just have kind of shocky, kind of tingling and numbness and not necessarily pain. And so that's one of the major symptoms, but it's not the major symptom. It's not the one that tells me that you likely, with over 90% certainty, have carpal tunnel syndrome. The second symptom that people have is they'll notice that they drop things often, with their hands, they start to drop things, or that when they're driving a car or a motorcycle or riding a bike that their hands start to fall asleep on them, or if they're using certain tools. And then the last most important symptom that tells me with almost 99% certainty that you have carpal tunnel syndrome, which we'll get to in a minute, is one that it disrupts people's lives completely, and it really drives them into the office to get treatment with me. And the treatment that we offer is a very unique one, and we do it all in one day. So because we do the treatment all in one day, we do the diagnosis, the treatment, you save time, you save money, and you get back to your activities because of the way we treat it through a tiny keyhole incision much faster. So we use a high resolution, the way we treat it is with a high resolution ultrasound guided approach. We use ultrasound to confirm the diagnosis. Even though you have this one big symptom, I use ultrasound and confirm it. And when you meet the criteria on ultrasound for carpal tunnel syndrome, plus this other big symptom, nearly, I would have to say I'm almost 100% certain that you have carpal tunnel syndrome. And so when you come in with this symptom, I'll know that offering you a procedure is the right thing to do at that point. And we don't always, we give you the choice, but usually I know with 100% certainty that our procedure is going to work for you once we do the ultrasound. And the ultrasound is the most inexpensive test. It gives me more information than those shocky, painful nerve tests that people get. And it's about 10% of the cost, and you don't have to go to another doctor for it. I do it right in the office on the same day. So it really makes sense financially for patients and from a time-saving standpoint to just come in and get the ultrasound, and then we decide together whether you're a candidate for the procedure. But this one big symptom, you know, I want to get back to, I keep teasing you with this, but the one big symptom you're immediately going to recognize, because most people that have this, it drives them into the office, it drives them nuts, and it's because they're waking up at night with either severe numbness or tingling in their hand or severe pain in their hand. And it usually radiates into these 3 digits. And sometimes splints will relieve that temporarily, but and you can get these over-the-counter splints and wear them. But when you start waking up more than a few nights a week with this numbness and tingling, and let me also say that, you know, even if you don't have this, but you still have numbness and tingling in these fingers, that gets worse when you drive or when you work with the hands, you still may have carpal tunnel. You don't have to have this last symptom to have it, but if you do have it, it really means that you need to come in and see us. So the last symptom is really night pain and numbness and tingling that you're waking up with, and you're shaking your hands. People can't sleep, and it leads to a lot of fatigue during the day and can interrupt their sleep pattern such that it makes it hard for them to work and think during the day, make decisions. They're drowsy all day. And so if you're really tired and drowsy and you are having these symptoms, then realize that we can cure them, and you'll get the best night's sleep of your life instantly the night of the procedure. Most people are so happy because they sleep all night. We had one patient who never missed a day of work in like 20 years. We fixed his carpal tunnels, and the next day he slept right through his alarm and missed part of the day of work. And his boss sent out the cavalry for him because he had never missed work before, and they thought something awful happened to him, and it was just that his, you know, he was sleeping so well from his carpal tunnel that he couldn't get up the next morning and go to work. So, you know, when you realize how simple, how safe, how cost effective this is, you'll come running into the office and get your evaluation, and then we can talk about fixing you so that you can get back to all the activities you love and finally get a good night's sleep. So this is Dr. J, just from Carpal Tunnel Express. Please hit us with a like or a comment below, and then please come in and see us. Thanks.